I will be talking today about perhaps what is a new angle within this research field, looking at the environmental impacts of distance health and social care solutions, but not just from the perspective of climate and emissions impacts, but also through the lens of the Sustainable Development Goals. What I will cover today, basically there are four things. First, I will present to you some background on our study, which is a sister study to the VOPD initiative. Then I will go into the climate impact analysis that we conducted on such distance health solutions. From there, we will go and have a closer look at the SDG lens to see where the synergies and trade-offs might exist. And finally, I will outline some future directions of work. So a brief introduction to our project. We looked at two key components. One, what are the climate impacts? And by climate, we in this study focused on emissions, but we look more broadly also at biodiversity impacts and the whole holistic view on what constitutes sustainability impacts. And the second component looks at the SDG synergies. Our project spanned from June of last year and finished now. And we worked in close collaboration with both the VOPD and Nordregio. The basis of our work looked at co-creation workshops with stakeholders, data and systems analysis, desk research and interviews, which form the bulk of our data collection and evidence base. Now, in terms of the climate impact, very briefly, we looked at a case study in the Storuman municipality. As you know already, this is a remote and sparsely populated region where 40% live dispersed across the municipality, and 8% of the population is over 80 years. We looked at two primary healthcare centers and three virtual health rooms, so VHRs or HCs as we call them now, which are unmanned facilities offering digital health services. So here you see a slide with the municipality, the Storuman municipality, and it shows you a graph of the population density and the location of health centers and the virtual health rooms. In terms of what our scenarios and assumptions were, for this study, we considered two scenarios. In the first one, we looked at the current situation where the patients would go maybe once to their health center, and for the remaining 3 out of 4 visits, they would go to their virtual health rooms. Scenario 2 looked at a case where there were no virtual health rooms and the patient would go to the closest health center for all their visits. There were many other assumptions underpinning this work, as you can read on the other side. But one of the key things to keep in mind here was that the patients visit the primary healthcare facilities using their own private vehicle. This was key. You see here in this slide, the catchment areas we looked at. These were the settlements closest to the health centers and the virtual health rooms. Our data sources were from primary care facility location data. We looked at a total population in a 100-meter grid aggregation. And we also looked at the proportion of population visiting the Storuman health centers and the frequency of their visits over the years 2017 onwards. We also consulted the road network data. So as you can imagine, large data sets were analyzed. And in terms of results, let me see if you see the slide. Yeah, and here we looked at the CO2 emissions that were saved. And for this, we used our Stockholm Environment Institute climate calculator, which we use in a number of scenarios to look at what were the emissions if we look at the average car in Sweden. So just a brief summary. The difference between the two scenarios, we saw an annual saving from visits to the virtual health rooms of, in terms of kilometers, so many, 205,000, and in terms of CO2 emissions in tons, more than 30. So key insights. Savings of CO2 emissions were about an average 31 ton per year. And using the SCI's downscaling municipal model for consumption-based emissions, this is equivalent to roughly 0.5% of total car emissions, or 1.5% of total electricity emissions, just to give you an idea. This is also based on assumptions on average driving speeds, the kind of car, etc. Moving on, if we look at some very quick conclusions and limitations of this particular work, of course, we saw that there were potential reductions of emissions using such distance health spanning interventions, but we would like to see a broader scope of analysis to include other sustainability criteria, which we'll come to in a bit. Health personnel travel was not considered here, and these are average or aggregate measures. So moving quickly from there to our Sdg Synergies tool. Now, what is the SCI Sdg Synergies tool? We're looking at how to make effective policy. This means balancing sets of highly connected but very diverse targets, as is the case here. Sdg Synergies is a practical tool for understanding how groups of policy areas and targets interact using systems thinking. Here is a brief snapshot of what our synergies tools show us. So first order and second order impacts across all the sustainable development goals. So if we just focus on SDG 11 or SDG 7, it shows us what are the areas that are impacted more, which would gain if you would work in one area, and where would you lose, or where would the trade-offs be. More closer to home, on this slide, you see the results from our workshop during this project on the SDGs and distance health. Here you see that when we looked at distance treatments or new digital technologies being used in health or distance monitoring, the key areas that were impacted were public-private partnerships, climate mitigation and adaptation, as well as areas around equity. Now, in terms of how we set up the workshop for this, we had representatives from policy, research, healthcare and design and implementation sectors, as well as experts focusing on more climate and SDG impacts. We used a methodology of co-production of knowledge, and it was facilitated by our Synergies tool. What we analyzed here were more complex systemic relationships, combining qualitative assessment of target interactions with quantitative network analysis. What was our main goal here was to broaden the agenda. So what you see here in this graph is a typical matrix that you get to see from the Sdg Synergies tool. And what that highlights is how can various distance spanning healthcare and social care solutions influence a set of SDGs. This is a novel area of research to see how can we impact a range of SDGs. We performed what we provided through this was a platform for deliberation, a space for learning and capturing these perspectives. And in a way, we think if this can make decision makers or policymakers think about distance care solutions in a broader sense, that might be actually the most important impact. In terms of next steps and future directions of our work, whilst we argue that there is potential scope for reducing emissions, we would really like in future stage of this work to look at other aspects of sustainability impacts. These could include equity. As Niklas mentioned before, time saved in traveling could equate time for work or different kind of value for our stakeholders in rural areas. Another sustainability impact could be biodiversity loss. Resource rights, looking at the entire value chain, especially for vulnerable sections of society. In terms of the Synergies tool, a next step for us is that we want to look at some of the contextual factors. In this study, we looked very much at a Nordic or Swedish context. What we would really like to do is explore what would be the more global aspects. What about low-income countries? What would the benefits on health look like over there? So there is much scope to broaden here. Some concluding reflections, if I have the time, is that distance health and social care is the future as we see it going forward. And to embrace that, we need to address a broad range of factors from digitalization, automation, last mile coverage, and look at the whole spectrum of SDG 2030 targets. This, of course, requires collaboration of diverse actors to address complex problems. Now, sustainability in this context needs to be both environmental, societal, and then also pivoting towards just transitions. So questions about equity. I will stop there, but on the last slide, you will see my email address here, as well as a link to our Sdg Synergies tool, which I very much encourage you all to try. And if you have any questions, I will be very happy to answer that. Thank you.